This is session 1 scan, 4/19/2021, Biomag Healer webinar for Dr. Garcia in tribute. Dr. Garcia once commented to me, "I just wish there was someone that could biomag me." Well, Doc, those that dare to fail greatly or dare to achieve greatness, either way, here's my attempt, Doc, with much love. I got balls, don't I? All right, Dr. Garcia, love you, man. And yeah, the two. Tammy says to Veronica, so glad the liver cleanse has given me many years of my life. So proud of you. You know, I think you've extended my years too, by the way, sweetie. Tammy, thank you.
Yeah, thank you.
All right, so may I be of assistance to Dr. Garcia? Yes. Can I help him tonight with magnet placements? Will the group help me too as well? Is there placements that will help Dr. Garcia today? Yes. All right, so can we begin the scan? Yes. So Dr. Garcia, tell me about your issues, sir. Oh, really? Yeah. You listen to people's problems all day, but nobody ever helps you? Yeah, I get that. Okay, cool. All right, let's see what we can do. All right, so scanning today, Dr. Garcia. Can we scan anything in his head today? Yes. Should we look at his book? Yes. So anybody want to scan head with me? I'm going to call out the numbers as we go like last time. And those of you that have books that want to play along, I'll be calling out the pages as I go. And I'm going to do it on the screen now. I'll just do it this way. Okay, so looking at Dr. Garcia's, so I have the scriptures book, and then I go to the Bible once I do the scan. So I open it up, and I started with Dr. Garcia's protocol, and I'm opening up to the Biomagnetism Beyond protocol. And is there any, connect me to Dr. Garcia, is there any issues we need to look at in his reservoir today? Yes. More than one? No.
I'm going to go get my books. I'll be right back.
Okay. Between 170, 150, 150, 160, 161. No, 160, Doc. Says the reservoirs, yes. Let me focus, Dr. Garcia. One odd number even. 148, 150, 152 renal capsule. HIV reservoir stimulates and restores kidney functions, yes. So kidney functions, 152 renal. Okay, is this placement on Maggie? Yes. Does he need more than one placement? No. Can you activate it? Yes. Are there any associated pairs? Can anybody confirm 152 reservoir clearing for Dr. Garcia or deny? Anyone get a yes?
Yes.
Yes.
2 yeses?
Okay. Three yeses. I was on mute as per your instructions. Sorry.
No worries. Thank you. Yeah, I mean, yeah. So is that enough time for you guys? And then we'll just do the next one. So as I'm reading it, I'm going to call it the page number first and then start scanning, and then we'll do the confirmation and we'll keep record. All right. So 152 renal, and then renal capsule, kidney, and I got kidney function. Okay. Any more in the reservoirs? No. How about the head? Yes. 26 to 30, 30 to 40. Am I connected to Dr. Garcia? Yes. 30 to 40. Yes. Odd number even. 32, 34, 36. 36A. Yes. Preocular. Yes. Toxoplasma. No. Tinnitus. Yes. Tinnitus. Yes. I'm sitting in an emotional Wi-Fi landmine you work at, Doc. That does not surprising me. All right. So this is for tinnitus. Yes.
Confirmed.
36A, yes.
You're getting
Yes.
36A. Anybody else?
How many more do you want?
There's 4 of us that said yes.
Oh, I'm sorry. I didn't hear them all. And that's on 36A?
Yes.
Thank you. Okay, so that's 4. Awesome, you guys. This is awesome. That was Sharon, right? All right, so is there any more on the head with Dr. Garcia? Yes. Past 36A, yes. 36 to 40,
Yes.
40 to 50. Odd number even, 40, 42. 42A, yes. Frontal sinus virus, yes. Abundant mucus. Is it current? Yes. Got a runny nose, Doc? 42A, virus. And I also want to know when they're viral, bacterial, so I have to see if there's a pattern. of the pathogens as we go. So abundant mucus, yes. Common cold, no. Headaches, no. Fevers with chills, no. All right, so 42A, confirm. Anyone? Yes,
Yep.
2. Yes,
Yes.
3. Yes, 4.
Yeah.
Yes, 5. Awesome, you guys. Awesome. And gals. Okay, so 43 to 50, yes. Odd number, even. 44, 46. 46A, yes. Orbital floor. Virus, another viral. Mascular degenerative, no. Keratose, comos, no. Affects retina, no. Something else, yes. And we're doing the placement 45A, orbital floor, yes. Are there associated pairs? No. So 45A, anybody confirm that?
Yeah.
I got a no.
Okay, yeah, call it the nose too.
I got a yes.
Got a yes.
Thank you. All right, so any more in the head? All right, now you all scan and just say the numbers. Did Jamie miss any placements for Dr.? Am I connected to Dr. Garcia? Did Jamie miss any placements that we can assist Dr. Garcia with the head placements today? Between the numbers 26 and 55. 26 to 55, is there any numbers? And then see
Yes.
if you get a yes, see if you can locate and just, odd number, even number between this and that.
Did we do 46 already?
No. 46A, I'm getting a yes on, and I wasn't going to get that. Wahoo.
That's what I got.
Yahoo.
I got a yes on
Yeah,
50.
so did I.
Wait, 46A we're on. And everything
Yes,
else-
I got a 46A.
Good job, Veronica. All right, I'm sorry. Somebody else said a different one, maybe?
I said yes on 51. I'm checking to see if it's A or B.
I get 51A.
Yes.
I do too.
I only get 51A, not 51B.
Me too. Me too. Okay, and any more heads? Anybody come up with anything else in the head? So you just found 3 placements, 2 placements, 3 placements. I did not. 2, 3. You found 2 placements I did not find, and you confirmed every single one of my placements. What are the odds of that? You tell me, Doc. All right. Any more in the neck? Are we finished with it? Are you finished with the head? I was at the end of it. I said, "Are we finished with head placements?" Yes. Are you sure? To make my fingers cross.
Yes.
That's when I know I'm done. Is when my finger crosses. Are you sure? Yes, I'm done. All right. So next one is any issues with Dr. Garcia in the neck? Yes. If I'm sitting in the chair holding ankles all day? Yes. Don't you know it? How long has he been doing that? How many ankles a day? That was the problem the guy had with me, is the heaviness of the ankles hurt his back from sitting there holding the ankles up all day. It's a position you don't have muscles for. There's nothing you're really trained to do. You have to keep your lats or something strong. And that's another reason why finger testing becomes such a great go-to. All right, so let's focus back. Connect me to Dr. Garcia, yes. Any issues in the neck? Yes. Odd number, even. 56, 58. Cervical plexus. Anybody else? I'm sorry, 59. 59 cervical plexus.
Yes.
Cervical plexus, whatever that is. Yes. 50 or 59.
That's your collarbone. All right, so any more? Yes.
I got 59B.
Yeah, I got 59B, but it's not on the chart here. That's what's interesting. Let me look in the book. I got 59B originally, but in his it may be missing from his.
This one says energy balance.
That is the cervical plexus.
Yeah, 59 is both of them are cervical plexus.
Yeah.
That's why it only has 1 page. Okay, that makes sense.
Bacteria
Okay,
ones.
cool. All right, so that one's good. Are there any more in the neck? How about the thorax? Connect me to Dr. Garcia, yes. Odd number, even. 60 to 70, yes. Odd, yes. 63, 65, 67A. Thymus parietal, right parietal, left parietal. So thymus black, parietal left. Yes or no? For Dr. Garcia.
Yes.
Yes. I had to reconnect with them.
Yes.
And you get left parietal, and check and see. Left parietal, right parietal. Make your fingers tell you.
Left.
Mine says right.
There you go.
I got left.
So did I.
All right. Now, Ask. Vertical, horizontal.
I got vertical.
I got horizontal. Now ask, should I do both placements? Yes.
Yes.
So what are we doing? We're doing a cross at the skull at the top of his head, right? So we're doing 2 placements. So you want to double up on the thymus? Yes. You want 2 blacks on the thymus? Yes. And you want the red parietal placed as well. So you want a red on the right and a parietal and left parietal, red and red? Yes. Does it have to do with measles? No. Yes. No. Have to do with the virus? Yes. So you got virus going on, Doc. 67A, viral. And we did 2 placements, red and right and left. And we doubled up 2X on the thymus with black. I'm just reading my notation so I remember what I do. All right, so thorax past 67, more yes, odd, even yes, 67 to 70, 70 to 80, yes, 70, 72, 74, 76, 78A, spleen, lung. Spleen, lung,
Yes.
Big.
Yes.
Yep.
Yes.
okay, that's a reservoir, immune system, yes. Respiratory issues, yes. So we're talking immune system and respiratory system. Okay, 78A, got it. All right, is there any more? Did Jamie miss any more for Dr. Garcia placements on the thorax? Yes or no?
I get a yes.
I gotta know.
Anybody got a yes? The numbers to scan for are between 63 and 83.
Is there a 65?
Yes. Is that what you're getting?
Yeah.
I just got a yes when you said that. 65, I get 65B. No, 65 is one, wait. No, there is no 65. Yeah, there is. Supraspinatus, yes. I get the yes on that. 65, supraspinatus.
Yes.
So TB, shortness of breath, gall, or kidney stones. Kidney stones. Kidney stones, yes. Kidney stones, Doc. Okay, that is 65A. Kidney stones. Supraspinatus. So do you remember in the Dr. Garcia's picture, and he's opening in his USA Biomag, his head website, he's standing there, and what does he have on his shoulders? The supraspinatus placements.
Yeah.
All right, any more in the thorax that Jamie missed? Good catch, thank you. All right, moving on. Dr. Garcia, yes. Abdomen, yes. Odd, even. 84, even, yes. 84, 86, 88, 90, 92, 94, 96, 96A. Stomach pylorus, bacterial. Gastritis, digestive orders, diabetes, yes. Diabetes, yes. 96, diabetes.
I get a yeah.
Give me 2 answers, diabetes and the number.
She's saying yes for 96, right?
Correct. Stomach pylorus. And I'm asking, is the diabetes an issue?
Not yet.
And then stomach cancer, no, but diabetes, I'm definitely going to yes. All right, so 96 to 100, yes. Odd number, even. 96, 98, 98A, stomach sacrum. Got stuff going on in the stomach here. Bacterial again, intestinal pain and bleeding. Intestinal pain, bleeding, no. Hiatal hernia, no. Bacterial breast, 98, 98A. Okay. Any more on the abdomen? The abdomen, yes. Are you sure? Yes. Okay. Anybody, am I missing anything on the abdomen placements?
Yeah, I got a 94B.
94B, thank you. And it goes from, there's a lot more, 84, page 84 to 122. 84 to 122. I got them all the ones I needed to get.
I did it twice and I got 99 both times.
Okay, thank you. A or B?
I'm getting both actually.
Okay.
99A.
I get 99B. I don't get 99A, I get 99B. Okay. So no more abdomens. That's good. All right. How about pelvis, Elvis? No, nothing in the pelvis. I get nothing in the pelvis. Dr. Garcia, yes. Anything to scan in the pelvis? No. Are you sure? Yes. Anybody get anything in the pelvis? Numbers between 123 and 136.
I get a no.
Anybody else get no for pelvis?
I got a no too.
Oh,
4 in a row. There we go. All right. So any posterior, Dr. Garcia, any posterior thorax? No. Arms? Yes. 138 to 140. Wait, odd number, even. 138, 140, 142, 144. Deltoid insertion? Yes. Carpal tunnel, frozen shoulder? Yes. Got trouble with the doc with the shoulder? 144. It's bacterial. Deltoid insertion. 144. Anybody get a yes?
yes.
Yes. Jamie,
Hey,
Jamie, going back to posterior thorax, what are the numbers that you have on the pages? Mine seem to be off by 2 or 3. So what do you have for the, and I'll do it while you're scanning
Yeah,
the rest?
this is the old one. So it's 174 to 184.
Okay, thank you.
I went back to this because I can read it better. It's bigger print, but it's the old numbers.
Okay.
Thank you. Sorry to confuse you. But just the finger test. You don't even need to have the book. That's the other beauty of all this.
Yeah, I just need the parameters, the numbers.
All right. So Dr. Garcia, any more with the arms? No. How about the legs? Yes. Odd number, even. 180 to 190, 190, 190, 190,
Okay,
94. 194A I'm getting.
I'm getting,
I get a yes.
Greater
and then
trochanter.
second, yes.
I actually get a 194B.
Anybody else get a B?
I gotta be,
Where do you
I
got
got a no.
where do you got to be?
And can I share the posterior thorax?
What page?
It was a 180, the vena cava.
You know, I get a yes on that too. 180.
Yeah. Oh, it's interesting. It has hair loss in there.
Huh.
You know how
I
that's
get a yes on that too.
yeah.
I do too.
Good. We got you, Doc.
Yeah, I'm gonna help you.
Well, no, it's just, it'll just be interesting to hear the feedback. He's going to be really busy, so I don't expect us to hear from him for a while. But I think he'd be very interested of what he's seen do and see if it has any resonance with what's happened with where he's at. Anyway, so, worst we can do is go 0 for 100. All right, so posterior thorax, I get no more arms, no more legs, no more. Special pairs, no. Dr. Garcia, yes. Dysfunctional pairs, no. Emotional, yes. We'll deal with that another time. Unless we find it on this search here. All right. Did Jamie miss anything in Dr. Garcia's scan protocol we need to look at right now?
Oh, that we need to look at right now.
Right now. Do we need to go back and look at anything?
No, not right now. But there is something missed, but it's not urgent.
All right. So I'd ask that, if we had a group and they said yes, we'd go back and scan head, neck, or thorax and see if we found something else. And most of the time we would. So that would be like a secondary group would take our work and then they'd blindly look at our work and see what they come up with. See what I'm saying? And then that would be confirmation on confirmation. And we'd know we'd have the person dialed in because everybody'd be confirming it just like you guys are all doing tonight with this stuff. All right. So does Dr. Garcia need any placements for the most common pathogen list 2020? Yes or no? I get a no.
I get a yes.
Okay. Is it on,
And I don't,
is it on the left side
Yeah.
of the sheet Jamie's looking at or on the right side of the sheet?
right side.
Anybody else?
I get the right side also.
Okay. Anybody else? Right side common pathogen, Dr. Garcia?
yes.
Okay, now, is it box 1, box 2? Is there more than one?
Yes.
Yes.
Okay. Is the first one odd number or even number box?
I got even.
Anybody else even?
Yeah, I got even as well.
All right.
Yes.
Okay, let me read them off. Number 2. We're looking for the first one. Number 4 or number 6?
6.
6.
I also got 6.
It is so much fun.
How many got 6? 4 of you? One,
Yeah, I think all of us did.
Yeah.
All right, so I haven't been here before. So pathogenic parasites, and this is his pathogenic list. And so now we're going to look at the numbers between 1 and ask the first question, is this the right box? Yes. Are we looking at more than 1? No, just 1. We're looking for 1.
In this box, yes.
All right, is the number between 1 and 8, is the number an odd number, even number, and between 1 and 8?
Even.
Even.
I got
6.
6, me too.
All right, 6 is roundworms or cytoseracosis. I get roundworm.
Me too.
Okay, 6A, 6.6A. 6.6A. So I want to take this and make it so it has the numbers where we can identify each box by identification. So now let's find the next one and go back to this and we'll get started that way. All right, so now is the next pathogen on the right side of the page as well? Is there another pathogen? If it's so, is it on the right side? Yes or no?
Yes.
Okay.
Yes.
Odd number, even number?
Odd.
That's
so funny.
Who is
Lily.
that? I don't. Who?
Lily.
Oh, Lily. Okay.
Hi,
cool.
Veronica.
Hello.
I see how much you're setting your intention. I love it.
Oh yeah, it's just total connection. Yeah,
All right,
I love. So you don't have to do the little fingers, huh?
I am.
Oh, you
I'm doing
are. You look
I-
very focused.
That's my confirmation. I feel it and then I check.
I love it.
well, and the
Yeah.
other thing too is like you're getting stuff I'm not finding, so I'm like, I got to do better. You know, it's like
Oh,
really, no, you're bringing up stuff that, I mean, if we want to really deal with getting to optimal health, it's just getting as good as we can get at this. So the group.
Jamie, can I
Yeah.
share something about that just quickly?
Let's just save it for later. Write it down. Let's keep on focus on Dr. Garcia for getting through this because we got an identified placement we want to do. So we want to stay focused on that while our intention is there. So now we found that it's number 8 or 6. I'm sorry, see 1, 2, 4, 6. 6.6A, which is roundworms. Now, Dr. Garcia already knows the placements for roundworms and I do not. So I can do it one of 2 ways. I can go to the spreadsheet on Excel and look up roundworms, which I'm not sure if I identified that yet. I got to break down the worms, or we can do the general scan. So scan with me. Dr. Garcia, roundworms, can we help him with placements today? Yes. Are we looking for more than 1 placement? No. 1 placement for the roundworm placement? Yes. Head, neck, thorax, abdomen. Scanning the abdomen. Page 5. And all right, and abdomen, yes. Is both placements on this page? Yes. Is it a pair? Yes. So I want to know if he's already identified it. Between 80 and 90, 90 and 100, 100 to 110, odd number, even 100, 102, 104, 106, 108, 110. You want 110A? Anybody else 110A, ascending
yeah.
right kidney? 110A. So 110A is that for roundworms. And Veronica, let's look up for shits and giggles 110, if this is the right page, and see if it says worms at all. Species with greatest clinical evidence of cause of opportunistic infectious diseases, goes to lung and causes so I'm going to scan, Doc, as what you're writing. Does this apply to Dr. Garcia? Yes. The pneumonia, yes. Bacterial, yes. Right kidney, yes. Species with greatest clinical relevance causes opportunistic infectious disease, goes to lung and causes pleurosis, bronchitis, pneumonia, bleeding in the lung, non-sequential infection, urinary tract, yes. Sepsis, yes. Soft infections, surgical wound infections. Go ahead, Veronica.
Yeah, that's the sepsis is what came up. And I also got 104.
So we didn't find what we were looking for, but I did confirm that this was correct.
Want to hear something funny, Jamie? 104 is flatworm.
Veronica, let me focus. I need to focus, okay? I really need to focus as I do this. So sepsis
Sorry.
and urinary tract. Okay, now, is this relating to the flatworm? Yes. Is there another placement? No. So I'm not finding another placement. So what did you find?
104B.
I'm getting a yes now. See, this is, you're confirming.
Yeah, I'm getting a yes also for Veronica.
Is that Lily?
Yeah.
You guys are good.
104B, yes.
104A or B?
E. E as in boy.
Yes.
Dealing with the abdominal. Look at you guys. You're good. You're good. You know, you're really good. You're good. You know, you're really good. This is you. Let me read it. Pancreas, body, spleen. Yes. Dogs serve as primary host. They don't have dogs. Hoofed animals, lower stages as well. Serves as adult stages of this flatworm parasite. Good job, Veronica.
Love you.
Well, what are the odds? I mean, of you, we were talking flatworm. We found a pathogen. I didn't find it. You found it. And then you said, okay, well, I found another one.
I have one thing to say that would take 1 minute that would make a big difference in what we're all doing together. It really, it's important, if you don't mind.
Go ahead, hurry up.
Okay, so when a sphere, round sphere,
I gotta stay
one
focused.
energy,
Go ahead.
I am. When one energy comes together, that's a round sphere, another one comes together, the two join makes a vesica Pisces. In that third energy, a whole new reality opens up. When we join, as we're doing the scanning, we're able to exponentially amplify what's hidden down under many, many layers. We're able to bring it up. So one person by themselves can get so much, two will get more, 3, 4, 5 will get a lot more. So that's all I want to say.
Okay, let's stay focused on pathogens. Pathogens are what we're trying to help with. And are there any more pathogens?
Thank you, Veronica.
Sure.
Are there any more pathogens we're focusing on today on this list? Yes or no?
I gotta know.
I got to know too. So I wouldn't have found what you found. So good job, you guys. All right. So here's a big one. Is there any tumor phenomenon with Dr. Garcia?
I got a yes. That showed up before.
Yeah, I got a yes too.
Yes.
All right. The numbers are between 309 and 310. You want me to read them or do you want me to just scan yourself?
No, I'd like to scan. You said 309 and
309 to 320. Call out what you get. 309 to 320.
314.
I confirm that.
14. Just got that.
314.
Dysplasia. Active or benign?
Active.
Active.
Wow.
Yes.
Wow. Hear that, Doc? All right. So now
320.
I get a no on 320. Anybody else?
I got a yes.
320 as well.
I must be on Veronica's bandwidth or something.
Yeah, I get 3. Also.
No, I'm just trying to focus on procedure. I mean, bottom line is procedure.
Yep.
So we stay focused on procedure to get the person better, and the woo and all the other stuff we can get into, but it's more about execution than it is about, you know, the bigger.
That's the fun part, the woo-woo.
I know, but this isn't the woo-woo time, is what I'm saying. It's doing it. If I'm helping somebody and focusing, I'm looking at this. I'm not researching other things. I'm focusing on what my intent is for this moment right here. And that's to read the chart, to do the healing, to do the placements, to find the issues, to make the person better. That's why I'm sitting here right now. All right, so tumor phenomenon and finding tumor phenomena, Doc, right? All right, so we found 314, yes, 320, I'm still getting a no, but let's do 314. And this is really important, bacteria, virus, fast growth. So now we're gonna search in bacteria, and I don't know if Dr. Garcia, I believe he does, has a whole list of bacterias, but we don't have that. So let's scan the first bacteria is in the head. We're looking, show me the first bacteria, yes, is in the head, the neck, the thorax, the abdomen, the pelvis, yes. So I want to look in the pelvis for the first bacteria, yes. Okay. All right. Elvis. You think Elvis was named Elvis because of Elvis pelvis?
Yeah, because he shook his pelvis, yeah, that was it.
Connect me to Dr. Garcia. All right, so odd number even, 124 to 130, yes, 124, 126, fallopian tubes. Fallopian tubes, doc, virus, yes. Is this what we're looking for? No, we're looking for bacteria, but do we need to look at the 126? No. All right, so we're looking for bacteria. Pelvis, yes. Oh, I know, what's next to it? 127. Does anybody get 127, bladder? For the first bacteria placement?
I can say yes.
I gotta know.
I got a 127B. Is that?
That's what I got too. So 3 yeses, 1 no. And
It says check for resonating virus on 127B. I had that in handwritten notes.
yeah, I made a mistake. Bacteria, virus, not 3 bacteria in a virus. So bacteria, virus. So did we find 127B? Is that the first placement we need for dysplasia for Dr. Garcia? Yes or no?
Yes.
Yes. Okay. So, when it's important, you pay attention and you really keep asking over and over and prove that you're right. Prove that what you're finding is important, because this is important. All right. So now we're going to another bacteria, head, neck, thorax. You want the next one in the thorax? Is that the second bacterial placement? Yes. All right. Thorax, we're looking for, it's already showing me. 55. Anybody get a yes?
Absolutely. Like
Got
that
it
was.
right away.
Yes.
Before I even looked at it, my fingers were already crying. What are you doing?
Yeah, I didn't even do my fingers, and I was like,
Wow, larynx. Okay, cool. That's a bacterial too. What are the odds? I mean, there's 4 pathogens and reservoirs and special pairs, so it's like a 1 in whatever chance of finding the bacteria by your scanning. Again, proving this shit works. All right, so now we're looking for the virus. Yes, yes. Do I need to go to Dr. Garcia's viral sheet? No. Can I find the virus scanning the protocol sheet? Yes. All right, the head, the neck, the thorax? Yes. The virus is in the thorax? Yes. Odd number even, 60, 70, 70 to 80, 70, 72, 74, 74, 74. Where'd you go? 74. $75 anterior costal Ebola, no. Anterior costal, yes. 75 B, yes or no?
Yes.
Yes.
So what it's doing is showing me when I'm close, but it's not showing me, sometimes your fingers will get you close and then it nails it when you go down a number or 2. So sometimes you can look and find not the exact page number, but you're close. Like
Yeah.
I'm looking, like I found when I looked, I said 74, yes, but it was a fungus. And I said, is the virus nearby? And it said, yes. And it said 75. And I said, yes. And it was a virus. So that's how sometimes you miss, you're not there, but you're close. Your fingers are telling you you're close.
you're warm. You're warm. Hot.
Exactly. All right. Now, are there any, are these the placements for the dysplasia to help Dr. Garcia? Yes. All right. Are there associated pairs for these placements? No. Should these pairs be repeated? Yes. Every day, every 2 days, every 3 days, every 4 days, every 4 days, doc. 4 days.
Jamie, I also got 128B before.
Anybody else get 128B?
Yes.
I get a no.
Are we doing reservoirs?
Not yet. At the end, we'll clear with the reservoirs.
I'm getting a yes on 128B.
Yeah, it is a reservoir, Hank, though. It says universal reservoir.
Look at that. I mean,
There you go.
that happens so many times now when I try. My focus is when I finish, my last thing I do is reservoir clearing no matter what. And to find the reservoirs at the end. And sometimes I'll find reservoirs during the process. And what I'm thinking is that they want to clear out the stuff that you just broke up. So they want to give it a flush before moving on. Does that make sense?
That's a really good point. Yeah.
And
'Cause
Dr. Garcia, if you're still with me, sir, has brought this to the level of using the reservoir clearing at the end, and during the process, the Herxheimer events get greatly reduced because now as I understand it, the cells get broken up to a small enough molecule that it can be used for fuel by the healthy cells that are now rebalancing.
Beautiful.
And it'll accelerate your pH, getting back to a state of homeostasis. All right, Doc, dysplasia, that's what we found, right? And then what's next? All right, so is there any more placements we need to look at for Dr. Garcia, yes or no?
Well, include the emotional, yes.
What?
Emotional pairs come up.
And
in our space.
yeah, he gets to ask all these probing questions. It'd be interesting to do that with him. Maybe he'll come on and he'll do this with us and we can do emotions and put him on the hot seat. That'd be fun. All right, so what I want to do now, since now my focus is on the tumor phenomenon, that's my primary focus over everything else. The last thing we found is the first thing I want to deal with. So now I'm going to look on the book, but I don't have to, because what I can do, and this streamlines the process, is since I have the placements on Maggie, and then I got the pathogen placements, and I've just almost finished all the vaccine placements on Joe back here, I can see my intention. So now I can look at page 55 and I make sure that I look at each page, making my intention known, because sometimes you have to drill down more. So I'm going to go with the first bacterial placement, page 127 in the book, the Bible, the Bible. I just ordered 12 more books. I've sold 24 of them so far.
Wow.
Oh yeah, people are buying them up like crazy. I'm telling you, this is a thing. It's kind of fine. All right, so bacteria, bladder, yes. Dr. Garcia, yes. Associated pair, brachial, streptococcus, no. Incontinence, kidney problems, yes. Do you want vertical placement as shown? Yes. Do you want a black on the right, red on the left? Yes. Is the placement on Maggie already? Yes. Can you activate it, that please, for 15 minutes? Thank you. Do you need an additional pair? No. Is there any associated pairs we need to place? No. Should I go to the next placement for the dysplasia? Yes. All right, so the next placement is 55. So the next placement is 55. All right, so 55A, 55B, bacterial Bordetella pertussis, doc, yes. Affects thyroid, no. Hyperthyroidism, yes. Anybody else get hyperthyroidism, Dr. Garcia?
Yes.
Yes.
Okay, do we need to set our intention further? No. Is this dealing with dysplasia? Yes. Can we activate the placement for 15 minutes? Yes. Do you want additional pairs? No. Any associated pairs? No. Should I move to the virus? Yes. So larynx been activated for 15 minutes. He's in New York, so we're on the same latitude. If it was more time up north, somebody up in Washington, I'd add 5 minutes, and you can lower it for people south of here. And hopefully I covered that in the book. I meant to, and hopefully I did. All right, so staying focused, Dr. Garcia, 75. Okie dokie. 75A, 75B, Ebola virus, yes. Dr. Garcia, yes. Severity of disease varies widely. Studies, suspected correlation, genetic differences, no. Since dealing with dysplasia, yes. Do you want double the placement? Yes. Anybody get double the placement on page 75B for Dr. Garcia? Want double placement?
Yeah.
I've never asked that before, double the placement. Why did you ask that?
Great question.
No, I asked it. No, I didn't ask it before. You're right. I just felt it. But I should be asking every time. Have I missed any of those? Yeah, the first one I did. Do you want any additional placements? No. Does it need any more power? Those are usually what I finish with. So the good catch on that. So Ebola virus, yes. Double the placement, yes. Do you like those placements? Yes. Does he need to continue with these placements? Yes. Every 4 days, yes. So anterior costal doc every 4 days, please, as well. So that's 75B. Okay, is there any more issues with dysplasia we need to deal with today? Are you sure? Yes. Does everybody we're done with the dysplasia?
All clear, yep.
Yes.
Done.
Yeah.
Yes.
Thank you guys
Yes.
for staying with me. This is so huge. I can't tell you. And I can't imagine what Dr. Garcia is going to be thinking when he's watching this.
He's
If we get one thing right, I'm going to be happy.
He's gonna say, "Oh gosh, I have to take how much time to watch this because he has so little time."
The master has been teaching us, and he hasn't seen anybody. I mean, he's seen, but like Danielle and stuff, she's got her business, but he doesn't get to see it done. Or I don't think. I don't know, but I wouldn't think so. So anyway,
I think it'd be even better than that. I think he's going to feel the results and report.
yeah, and he can lie to us and tell us he did too. That'd be cool.
Or he could say a couple of things, guys, or something like that.
Or we can send it to Dr. Garcia's wife first and let her review it and see it.
There you go.
Huh?
There you go.
His birthday's coming up. I know. Let me see. I got his astrology thing. Let me see. It's coming up soon. I think it's around Tammy's birthday.
When's Tam? Mine's next Saturday, the 24th.
I'll let Tammy tell her when she's going to be 65.
Yeah. Amy's going to be 158, and she's
All you Venuses, all you Aphrodites, man, you're all coming to fruition right now. So let me find out when that is. All right, so let's stay focused on placements now. Now we've switched from scanning to placements. You can do placement as you go, or you can read them off and then come back and do the placements and ask the questions. Either way, I think works fine. All right, so now we found placements. Should I start at the top? Yes. Sepsis, yes. Urinary tract, yes. All right, so we need placement 110A, yes. All right, so now we're going to the general scan. Go to the general scan. Ascending colon connected to Dr. Garcia, yes. Ascending colon liver, yes. All right, I get 110B, pneumonia, yes. Hep E, no. Transmutal fecal, no. Colitis, no. Bad digestion, bleeding, lung problem, spontaneous healing process. Do you want, is there placements on that? A Maggie already? Yes. Can you activate them? You want red on the colon? Yes. Do you want it right there? Yes. Can you activate it? Yes. More than one power? No. Any associated pairs? No. So 110 is placed. 15 minutes, please. Thank you. Do I need to look further into the sepsis? No. Do I need to look further into urinary tract? Yes. Okay. So identified, and maybe that was with the 104B, the sepsis and urinary tract. So let's see what 104B is. And again, note taking as you go is important because you got to come back to it. 104A, 104B, yes. 104B, yes. This is dealing with sepsis and urinary. All right, so dogs, here we go again. Oh, there's the flatworm. We already did this placement, yes. We need to repeat this? Wait.
double up, maybe.
Did we do this already?
Yeah, we did. Wait, which number? I know we did the flatworm.
Well, we did the flatworm, but look at this.
But is it-
104B is flatworm too. Holy shit, Batman.
No, that we did 104B. It's pancreas body spleen. We did that already.
Oh, it's on the previous page, huh?
Yeah.
Oh, okay. It just brought it up again. I guess I doubled it up. All right. So we found that twice for whatever reason. So if I found that twice, does it mean it's more important and something we should focus on? No. So sometimes it's telling you to take another look at it again for whatever.
I got a yes. I got a yes.
That I should look at. Does it need to be doubled up, the placement?
You could just do it intention.
No, just ask the question. Do I need to put another pair of magnets on 104B?
Yeah, I got a yes.
You got a yes? Okay, good, because I didn't get a yes on that. All right, so that's easy to do. You want the red there? Yes. You like that placement? Yes. And you want the pancreas body there? Yes. So there's the belly button. Can that be the pancreas body? Yes. You like the placement? Yes. Do you need any double power? No. Is that good? Yes. All right. So that's doubled up. Thank you. And all right. So now we get the dysplasia we found already. 314, 320, and we went through that already. Now I'm going back to the first page, head to toe, and 152. (152A or B? 152A, 152B. Vagina, yes. Testicle, yes. Universal reservoir, you want some clearing? Yes. Is a placement already there? No. You want it doubled up? Yes. So I get double 152. Testicle, you want black on the right? Yes. Black on the right, red on the left. Do you like that placement? Yes. All right, so 152B is placed, check. Do I need to look at any associated pairs? No. Is this reservoir clearing? Yes. So it's clearing reservoir again. And that was at the beginning of the first scan I did. So 36A, and we got 4 and 5 yeses on every single one of these right off the bat, which is great. I don't know how many people are scanning though. 36A, but it seems to be the same ones every time. So, all right, 36A. Anybody else? Yes. Transmitted wild birds? No. Same side. Low virulent pathology. Single weak immune system? Yes. Do I need to look at the immune system? Yes. Okay. So 36A immune system. Yes. So I need to scan the immune system. Yes. Will it cover it with future placements? Yes. Then I do a scan. Yes. Okay. So 36A, low virulence pathogenic bacteria can produce infections through the body, lungs, brain, heart, eyes, lymph nodes, respiratory symptoms, auditory symptoms, TNA, bruxism, facial paralysis with a weak immune system. Yes. I just keep getting weak immune system. Do I need to scan the immune system right now? Yes. Okay. So I'll have to pull up the spreadsheet for his book and look up under immune system what placements. I'll come back to that. All right, so the next one on the sheet is 42A. So basically you're going from head to toe when you're doing the placements. Not always, but that's how he's laid it out. All right, so 42A, yes, frontal sinus. Now, tense headaches, blocked nasal fossa, yes, mucus. Remember we found the mucus earlier? Frontal sinus, here we go again. This is, I'm finding it, everybody's got this. Sinusitis, remember last week and the week before I was talking about it? Sinusitis, yes. Is this from spraying? Yes. So we need to add this, if it's not already, into the heavy metal detox. 42A, doc. Does Dr. Garcia need a heavy metal protocol clearing? No. Anybody in his family? No. Okay. So is this dealing with the mucus? Yes. Do we need to double up the placement? No. Do you like those placements on Maggie? Yes. Can you activate it on her? Yes. 15 minutes? Yes. Any associated pairs? No. Okay, 42A, check. 45A. Eye cerebellum. Optic nerve, yes. Inflammation, optic nerve, yes. Injury or damage, yes. Damage to the hippocampus, yes. I'm getting damage to the hippocampus.
I got it too. It's almost like a chemical or a sprayed toxin or something.
I got a yes on that too. Has Dr. Garcia been sprayed? Yes.
I'm getting he's really under fire right now. It just came through really strong and it really hurts.
I'm getting it's from some disinfectant. Damage is caused by some disinfectant he's taken or had to take. Hippocampus.
In his bathroom. That's I'm saying it seriously. Whatever they're spraying in their bathroom may be part of it. But he's also getting nailed. Well, obviously, but all
right, so do we need a hippocampus placement? No. Okay. So eye cerebellum, activate, yes. Can we activate on Maggie? Yes. Do you need more than one placement? No. Is that good? Yes. Do we need to do a follow-up placement? No. All right, and that's the other thing I forgot to do, or I do at the end. I do all the numbers, and the last thing I do is go back to these need follow-up placements, or you can do as you go, which you really should do. So, and then keep track to give the person the placements they need. So does Dr. Garcia need to do follow-up placements on, I'm going to backtrack, 152, 36, 42A, 45A, yes. So I'd put an F for follow-up, and then I'd say 1 day, 2 day, 3 day, 4 day. So every 4 days he's getting this protocol, and then I give him a list of placements to do if they have the magnets. All right, so 46A, look at, yes.
Jamie, can you program Maggie to do that in 4 days, or do you have to, or do you usually have the person connect in some way?
I don't know, but I trust myself to do it that day and see what I come up with. I do it just real time, you know. Okay. You may be able to project it out and say, set this for every 4 days. That's a great idea. We'd have to do some tests and trials and see. I would be interested in what Dr. Garcia has to say about that. But
Daniel,
And Daniel would say, of course you can.
yeah, the codes. That's exactly. It's like you can program.
I put the codes in the book too. I included the codes in the book, and maybe that's going to work. And if that works, we could have an answer to this huge problem by doing the group clearing in a major way, and everybody learns the codes. And then we all learned a muscle test. I had a dream about this. All these sick F movies out. If everybody learns the muscle test, they can ask the truth question and get the answer without any bullshit from anybody else. And if everybody muscle tested, they'd all know the truth, and watch how fast the world would change.
Wow, I love it, Jamie. Wow.
Watch how fast the world would change if everybody had their own bullshit meter that they could rely on. That's what this is, a huge bullshit meter on top of everything else. All right, let me focus again. Dr. Garcia, canthus lateral, yes. All right, so this found in the environment, yes. Is this from the toxins that Veronica was referring to? Yes. Is this from antiseptics? No. Disinfectants? No. Something they're spraying in the buildings? Yes. Because all these buildings, like he's going to work and stuff, so they're disinfecting the walls every freaking day with crap.
Oh, it's about, yeah. Okay, that makes sense. Yeah.
You can't escape it. And I'd like to do a study on people with a sinusitis, if they're going to work, if they're in places where they're doing heavy disinfecting without all the crap that's really bad for you. Oh, it's good for you. Alcohol. Oh, geez. Disinfect. Right. All right. So back to Dr. Garcia. Does he need follow-ups? No. Follow-up placements for Dr. Garcia? Connect? No. All right. 51A. Yes. Are there any associated pairs on 46A? Double deployment. We got it. Okay. 51A. Yes. Inframental tubercle. Inframental tubercle. That's hard to say.
IMT. That's what it is.
Say bottom of your freaking chin. I mean, why do they have to use these words? Bottom of chin. Got it. Anyway, vulgaris. Yeah, they have to use words like vulgar. High mobility frequently provokes oral problems. Part of the periodontal. Is this periodontal with Dr. Garcia? No. Am I connected to Dr. Garcia? Yes. Is this something for something else? Yes. Do you need to drill? Yes. So this is our first drill down.
Jamie, that it is periodontal, that it is the pathogenic flora of the mouth. I got that there was something there.
I'm getting floral too, yes. Is this an existing issue? Yes. Something he's dealt with for a period of time? Yes. From something to do with his jaw? No. From his teeth? Yes. Right? Periodontal? All right. So now I'd go to the tooth chart in the book here. And I'd want to locate the tooth
In the Bible?
in the scripture. So now I've got it. I don't have it up on the screen. I'm just here. You can look at it. All right. So now I go to here.
Oh, I don't have that. No, I don't have it in the book, but I know that chart.
Well, that's why I'm going to start selling these. I put together a bunch of them and included all the latest because we keep upgrading. And so we need to keep, everybody's got a scripture and they get on the list. I'll keep sending you the upgrade. So anyway, staying on Dr. Garcia. Connect me to his teeth issues. Yes. More than one issue. No. Top, bottom. We talking molar? Yes. We talking left side of his mouth, right side of his mouth. Right side molar. He's got this chart backwards.
Third in from the wisdom.
All right. So numbers 45, I get 47. Anybody get tooth 47?
What is the range?
36 to 48.
I did get a yes for the 47.
Yes.
Yeah.
47. How about 46?
No, I got a
47.
I got, yes, 46 also.
It's
Okay,
affecting.
so now I'm going to ask, is it in the lumbago, rheumatism, connective tissue, elbow, shoulder? Remember we got frozen shoulder before?
For him?
Yep. Frozen shoulder.
That's what I got. Elbow, I got elbow, shoulder,
Okay.
both.
This is connected to the tooth 47? Yes. Now, is it lung or large intestine? No. Do I need to look at the associated nerve to this? Yes.
Yes.
Now I'm going to look on the next page. Where did you go?
Yeah, the nerves affecting the 46. Next one.
I'll show you what I'm doing so you can follow in here. So this is what I go to next. And this again is in the, I should just go by the book, Jamie. It's so much easier than pulling this stuff up. Duh. So this is the nerve chart I use. Let me go to the book. It's all right in the book. I don't even know. I'm not just looking at the book. This is like making my work harder. Because this is what I used to do, and now I don't need to do it because the book is almost ready. Oh, all right. So now I'm looking for teeth. So I'm going to go control. I already know it's down in the scanning, and I know this is the last chapter, and scanning is appendix 2. So I'm going to have these page numbers you can just go right to, and it'll save a lot of time just going to the page you need to go to. Or when you get the book, or copy it and print it out, and then you'll have the copies of the pages you want of all these that you're asking about, Veronica. They're all in here.
Okay, great. I can't wait to buy it because
It's already in your folder. It's already in your email. You already have this. You just have to
Oh,
copy.
is that what I just, okay, I saw that, but I haven't opened it while we were doing this.
All right, so I'm looking for teeth for Dr. Garcia, and this is the charts I use. All right, so first, and I just added this. This is you were asking me, I think, Veronica, about the pain placements on the tooth and kidneys and bladder and tooth. Notice tooth is black up here, kidney red, or bladder black, tooth red. And you're asking, well, somebody was asking about, isn't it red? I was saying, somebody saying, isn't it black? I said, oh, it's a red placement. And I got confused because I knew it was one, but I didn't know there was two. So this is I put in here so we can say, and anybody's got tooth pain, you can come right to this chart and just check it. You want it this one or this one. So is there any of these placements that can help Dr. Garcia? No. Is this issue we're dealing with on number 47 dealing with the nerves I'm looking at in this chart on the right? Yes. Are we dealing with a sensory root nerve? No. A motor root nerve? Yes. So if I'm looking on the motor root nerve, am I looking at the anterior alveolar nerve? No. The linguinal nerve? Yes. So I'm looking at the linguinal nerve. Where do you want the placement on the this third? No. This third? Yes. Before this third? Yes. Between. Show me on the placement where to put one. I get right here. So that's
whatever that is. Bing, bam, like bam.
Is that 47? Yes. You want it on the tooth 47 on the right side? Yes. You want to activate the placement to bring to balance the motor root nerve of the anterior abductor? Yes. Is the placement on Maggie? Yes. Do you need more than one power? No. Is the associated, is this a black placement? Yes. Is the red placement associated with the nerves? No. The red placement's in the head, the neck, the thorax, the abdomen. You want the red placement in the abdomen? Yes. So now I'm looking in the abdomen. So this is how you drill down to find out, as I do it, and Dr. Garcia has his way. So we located the tooth that wants a black on there, and I asked if that was the standard placement it wanted on the kidney, and it said no. So now I'm looking in the abdomen for the red placement. 84 to 90, 90 to 100, 100, yes. Red placement, yes. Odd number, even. 100, 102, 104. 104A, you want pancreas body placement? Yes, red. Can anybody confirm red pancreas body placement for tooth 47?
Yes.
Holy shit. It works, doc. It works. 104 pancreas body, red. And tooth 47, black, avlictar, however you say that, nerve. All right, so is this placement on the pancreas body? Are we looking for a nerve placement? No. Are we looking for an artery, a vein, a ligament, a joint, a muscle, space between it, something else? We're looking for something else. Do I need to identify it? No. Do you need more than one placement? No. All right, so it drilled down on the one placement to find the nerve, and then it just wanted a placement on the pancreas body in general, nothing specific. Did you get that part of it?
Gotcha. Mm-hmm.
Okay. All right, so are we finished with the teeth? No. Is there another placement for his tooth? Yes. Is it adjacent to 47? No. Is it another tooth? Yes. All right, so let's go back to our toothy chart. That's why this toothy chart is so, all these charts, you can just pull them up now and bada bing, it's right in front of you if you find it again. All right, so scanning another tooth. Anybody get another tooth? Yes, besides me.
Yes, I did.
Yes.
Okay.
Left side.
Top or bottom?
Left bottom.
Related to tooth 47, yes or no?
Yes.
Is it next door to 47? I get a yes.
Yes.
48, yes.
Yes.
All right, energy, headache, migraine, epilepsy, dizziness, blood, spinal cord, brain, ear, elbow, shoulder, ding dong. Shoulder. Do we have
Yes.
shoulder? Yes. Can we do supraspinatus placements? Yes. Can you activate on the Maggie? Yes. You want double the placement? No. Do you want deltoid insertion? No. Do you want bursa? Yes. Can you activate bursa? Yes. You want double the placement? No. Is there any other frozen shoulder placements we need at this time? No. Are we finished? Yes. Do we need to look at the heart? No. Small intestine? Yes. For 48? Yes. Small intestine? Yes. All right. So will I find this placement in the placements we've identified? Yes. All right. So small intestine, making a note. That's what I'm looking for in the first placements we're going to be doing. It's telling me it's going to be there. I don't need to scan for it right now. All right. So otherwise I'd bring up a chart and I'd start looking at small intestines and seeing where the placement goes.
I got another tooth one, Jamie, on the left side bottom that is related to the 47, but not on the, it's not connected next to it physically.
What number is it?
I don't know the numbers. If you can give me some numbers, I don't have a chart.
Oh, I'm sorry. It goes 11 to 8 or top or bottom. Bottom is 38 to 48.
Bottom, yeah.
Yeah, I don't get anything.
43.
I get a no. Anybody else get a yes on 43 teeth?
I get a yes.
Yes.
Look at you guys. I'm the odd man out here.
Yes.
You're the one doing all the work, Jamie.
Well, no, but look at how many you're finding, Veronica, in association in addition to what I'm finding. So is this tooth 43?
Tooth 43, yes.
All right, so I'm going to read it to you since I'm not getting, you're getting a stronger pickup. 43, concentration, yes or no?
Yes.
Yes.
I think he's tired.
All right, so is this dealing with a liver issue or a gallbladder issue?
Gallbladder.
I get
Right.
gallbladder too. So you just act, I had no, and then when you activate it, now I picked it up. You see how that works?
Cool.
That's why group think,
Mhm.
group scan, group whatever.
Better.
Group B in.
All right, so we're dealing with a gallbladder. Do you want a gallbladder placement? Do you want liver gallbladder? No. You want gallbladder? Yes. You want vertical? No. You want horizontal? Yes. Can we activate that on Maggie? Yes. Is there any other placements for tooth 43? All right, anybody have any other toothments? Good find. For tooth 43, does it need a follow-up? No. How about 467, 104? Do they need any follow-ups? No. Any associated pairs? No. All right, so that's how we just went down the rabbit hole, and we also worked on the shoulder, going through that part of it. So well done. I mean, that's what Dr. Garcia. He goes layers, 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 and layers, and layers, on layers, on layers until he's done it. And like he did Danielle, he spent 4 hours with her the first session. Can you imagine that? 4 hours.
Yeah.
The concentration it would take to just keep focused and help her, and then she got a full recovery and now she's teaching. I mean, what a success story.
Oh, she's teaching? I mean, teaching like,
I mean, not teaching, she's not practicing.
okay, yeah,
She's using her skills to heal others.
she is. She's amazing.
All right, so now we're dealing with page, that was 51. Is that 51? Yeah, it's right. 51B, where are you, 51B? Okay. Now we have page 70. 70A, 70B, Candida. I'm seeing this a lot too. Isolated organism, bloodstream infections, oncological, carbohydrates, acidity, warmth, humidity, organic matter. Does Dr. Garcia have mold? As soon as I hear warm matter, warmth, humidity, I ask it immediately, do they have mold? Sir transplant, ICU, parts of body infected include the skin, genitals, throat, mouth, and blood. Blood, yes. So it's something I need to look into, blood. Okay, and then 70, can you activate that? Yes. Is that on Maggie? Yes. Do you need any more placements? No. Do you need any more power? No. Does he need a follow-up? No. 70 is done. Next one is cervical 59, going backwards.
Yeah, this had the doubles. One was a bacteria, one was a special pair.
Okay. And cervical bacteria, yes. You want it on the herbs points? Yes. Is it activated on? Yes. Do you want more than one placement? No. Do we need to look any further? No. Are there associated pairs? No. Are we done? Activated. 59A is activated. Boom. Is this dealing with energy? Yes. All right. So 67A. 67A, thymus parietal, yes. Thymus parietal left, yes. Rubella, yes. German measles, yes. Does not have to be, don't even realize they're infected. Skin eruptions, no. Organ potentially causing, no. All right, so you want rubella, yes. You want more than one placement, no. Thymus, yes. Parietal left, yes. Can you activate the placement? Yes. So this is the placement that we got both. I got left again. Now, parietal right. Is anybody getting thymus parietal right?
I got a yes on that one.
Because you or somebody else said, yeah, I'm getting that, right?
Ooh, ow.
I put a doc, another present. I put all the TBI placements.
God.
Ta-da!
Hey, Jamie, do video, Jamie, on happy.
This is your work, Dr. Hang on, Veronica. Dr. Garcia, this is your work. This is what you brought us to. I still got to find the thing for the mill guide. I can't screw in that hole yet. But anyway, so this is the parietal right here. And so we found that it's a cross. Remember, we wanted to do a cross at the parietals? And which side it was going to be on. And the parietals are right at the back of the ears. And I've got two of them, and I'm missing one right here where there's a hole. So what I'm going to do is I'm just going to tape one. Because if you have placements on the Maggie and there's no placements, you just add them with tape. And then you can drill it in later if you want to make that a regular. If it's going to be something, if it's going to be a placement you think you're going to use, just you might as well drill it and get it done instead of keep putting tape on it. Save the environment. All right, so now I got to find if it's red or a black, and be careful because these things will snap at you. Okay. So I'm looking for a red placement, opposition there. There's red. Let it go. Don't. There's so many magnets they're going to want to flip, so you really got to hold it while you tape it down. Stay. Don't flip. Okay, Veronica, you like that placement? Yes or no?
Yes.
Thank you. Always want to ask you, when you do the placements, do you like that placement? Higher, low? If you get a no, higher, lower, left, or right?
Mm-hmm.
Okay, so that's 67. Are there any associated pairs? Does he need to repeat this? No. Can we activate both? Yes. All right, so 65A. We've got about 5, 6 more. 65A, supraspinatus, yes. Did we activate that already? Yes. Does he have TB? No. Do we need to scan for any TB pairs? No. 65A has been activated. 43A, yes, we need to activate. I think I missed that one. Or is that the one we found after? 43A, 43B, eyebrow. Yes. Any more RSV pairs? No, just eyebrow, respiratory, tremors, sweats, fears, irritability, neurosis, anxiety, sniffles, congestion, nasal mucus. Here we go again. Nasal mucus. I'm going to be really interested to see if Dr. Garcia has had nose issues lately. So can you activate eyebrow? Double the pair? No. A dissociated pair? No. You want to double the placement? No. Do you like that placement? Yes. Does it need to be repeated? Yes. Every 4 days? Yes. Okay. What, Veronica?
It's spring. That might be allergies.
No, I'm getting it's all the crappy, the walls and all the shit they're doing in the offices.
Hmm.
But it'd be interesting to see if he's feeling any symptoms like that. All right. So 43A, eyebrow, one placement, nothing common, but we're saying it was nasal mucus. Got it. Okay. Check. All right, so 96A, 96B, 96B. And Dr. Garcia's general night, he does an hour and a half session work. Stomach, measles virus, shingles, measles, yes. All right, do you want more than one placement? No. Do you associated pairs? No. Stomach, adrenal, does he need to repeat it? No. 96A is activated. 98A, the stomach, liver, yes. Stomach, liver placement, yes. Do you want to double up? No. You like the placements now? No. You want a red on the stomach? Yes. You want one more? Yes. Okay. You want to double up? Yes. So first I asked him, want to double up? It said no, and now it's saying yes. So I'm going to double up on the pylorus. You like that placement? Yes. And now the I'm sorry, stomach. My bad. You want a red on the stomach? Yes. You want a black on the liver? Yes. Sorry, focus. You like that for liver? Yes. Did I get that right? You want black on the stomach? No.
That's all right, Jamie.
Wait, I'm
Yeah, black on the liver should go over.
I got it right. Yes, that's correct. Yes. Okay. I was looking at the top one and 98A. I kept thinking, Dr. Garcia overeating? Yeah, right. All right, there's something else I'm getting. Do I need to look at it? No. All right, back to 94B.
Hey, Jamie, you said black on the liver, right? The stomach, liver on 98B.
No, black on the stomach.
Okay, that makes more sense. All right, thank
Black
you.
on the stomach, red on the liver. I was saying one thing and doing another.
Gotcha. Okay.
It happens. All right, so okay, so 94B. You 12 of you are still with me. Thank you. All right, so 94B, cardiac pylorus, group streptococcus, Dr. G, yes. Bladder, we already found that one. Group G, found in gastric digestive symptomology. Group A, allopathic, no, just do the placements, yes. Cardiac, black, yes. You want the pylorus, yes. You want red, you want additional one, yes. You want to double up on the cardiac, yeah. You want to triple up, no, double power. All right, so asking for double power on cardiac pylorus. So doubled up there, yes. And pylorus. Do you like those placements? Yes. Do you need any more power? No. Any associated pairs? No. Repeat placement? No. 94B done. 99A. 99B, pylorus kidney, yes. Left kidney, yes. Intestinal ambiobiosis, yes. Alters digestion, yes. Is this dealing with a kidney cyst? Yes. Is this dealing with what we were talking about, the kidneys earlier? Yes. Should we do another pylorus? Yes, but you want the black this time? Yes. So you want the black on the pylorus again. Okay. And do you want the red on the left kidney? Is it already there? I need to place it. Okay, left kidney.
That's just funny to watch.
It's just like, I don't know. If it works, it works. It's not exactly where I like it, but it's good. That's my intention, to put on the left kidney. All right, so that's 99. And then 99, somebody got 99A and B. So you want pylorus transverse column? Yes. You want another black on the pylorus. So that's how Dr. Garcia says you add strength, is it'll tell you it wants more in the next placement you find, the next one you find. Or Dr. Goy says, use more power right away. Ask if it needs more power. So now we're doing transverse colon. I want the red there on the transverse colon. So this is an area that's getting a lot more energy work in this area here. All right, so is there anything associated more with 99A or B? Are we finished with those? Yes and yes. All right, so 144 going down to the pelvis. Deltoid kidney, yes. Bite of flies, green flies, terrible alterations in skin, liver and spleen. Something else, yes. Do you want the black on the deltoid? Yes. Can you activate it? Yes. You want another a red on the right kidney? Yes. You want, is it already there? No, I need to put a red on the right kidney. Okay. So that means one was already there and one needs to be placed. The red on the right kidney. You like that placement? Yes. Okay, so that's 144. Now we're doing 194B. Two more. Let's see what else we find. 194B, 194A, 194B. Transfer fascia lata, retro, pectoral, yes. Small wart virus, yes. Eyelids, other points of the face, turn black. Hep B, no. Just do the placement. Left side, transfer lata, yes. Placed on Maggie, yes. And how about the red on the pectoral? Yes. Are those placements good? Yes. Do you want more power? No. Associated pairs? No. Follow up? No. 194 is placed. 180 vena cava, which I think is the one you found, Veronica. 180 vena cava, yes. You want this between the scapula and the T5 vertebrae? Yes. Athlete's foot, no. Ringworm, yes. Ringworm, yes. So we're finding flatworm, ringworm. We got the worms going on, Doc.
And in my handwritten notes that he gave, it's not a worm, it's actually a fungus, even though it says ringworm in there.
Yes.
Which makes total sense, right?
Mm-hmm. Mm-hmm.
And he says he wants this on the T4 vertebrae, and I'm getting double the power. So it's really easy now, T1, 2, 3, 4, 5. And even though it has center placements, if you do it slowly, you can put them next to each other like that. Okay, so you don't need to use tape. You can just use the center one and then balance it out. Do you like that placement? Yes. Do you need more? No. So again, a fungus, right? So are there any more associated pairs I need to look at? Yes. For Dr. Garcia, yes. Is it on the sheets that I've found already? I need to find something else. Yes. So what I would do now in the yes, since I finished with the scanning protocols, I would now go to the Excel spreadsheet, or I go to the front of the book, which I'll do first, and go through any more, Dr. Garcia, any common pathogens? No. Heavy metal detox? No. Anything to do with mold placements? No. Connected Dr. Garcia? Yes. Sinus placements? No. Sleep protocol? No. Lyme? No. Mosquitoes? No. Teeth we covered? Yes. TBI? Yes. You want me to look at the TBI? Of course you do. TBI placements, Doc. So then I go, are there any placements that can help with Dr. Garcia TBI now that I got all Maggie wired up, right? All right, so more than one placement? No, I'm just looking for one placement, yes. NZ, is it in this row? NZ, FPZ, AFC, FC, FCZ, CZ, CPZ, yes. It's in that row, yes. CP1, CP3. You want a CP3? Yes. The CP3, CP4 placement? Yes. You want the CP4 black on the right? Yes. You want CP3 red on the left? Yes. Do we need to look into it further? No. Can we just activate it? Yes. To help Dr. Garcia? Yes. Can you make it activated on Maggie? Yes. Do you want any more power? No. Is that good? Yes. I don't know what it's for. We just activated it according to his brain trauma chart. All right. Anything to do on the spine chart I'm looking at here? No. Do I need to look any further into the occipital 12 cranial factors? No. Anything to do with the Wuhan virus with Dr. Garcia? No. Anything to do with anything else? Are we done? Yes. If I was really going for it, if I really want to get one step further, I would go through the spreadsheet and go through issues and symptoms and see if I found anything. But
for what it's worth, I got something to do with his mask, and I'm not sure if there's something about particles. I don't know if anybody come up with something about that.
say it a different way. About his what?
About the mask that he wears.
Oh,
I found there was
I'm getting
a problem with
a yes on that too.
Yeah, me too. Big time.
So is the mask associated with respiratory? Yes. Is it associated with, what else did we find? The shoulder issues? No. Is it associated with pelvis issues? Yes. Is sinusitis? Yes. Is sinusitis associated with masks? Yes. Bing, boom.
What is the greater trochanter? Do you guys know exactly where that is? Because that, just as you're asking, that kept coming in. You know where that is?
It's, I think, no, instead of guessing, look. I'm learning, but I don't know.
Oh, I got it. I got it. Page 193. Okay. So 193A.
I want to say leg.
Yeah, it is. It's the hips, the outside.
Yeah.
193A, I kept hearing greater trochanter over and over again as you were talking about the masks, you and Hank.
I'm going to
And
guess on that too.
yeah. So that's how I get info too. It's sometimes I'll get words or I'll just see the visuals of where, and then I look up the name and stuff later. But yeah,
That's what happened. That's what happened to me with the mask.